Campsites like this one in the Gazan city of Khan Yunis now house some of the 1.4 million Palestinians who have fled Israeli bombardment. And now doctors are reporting patients are arriving with signs of disease caused by their close quarters and poor sanitation. With limited aid, including medicine, arriving into the enclave, a likely health crisis edges closer. Sujud Najim, her husband and 3 children share this tent with 4 other displaced families. They sleep on the ground without enough blankets to go around.
I've been in this tent for 9 days and I can't even bathe my children. If I go looking for water, I don't find any. If I do, it'll only be half a bottle and I have to bathe them outside of the tent in the open. I use the bottle of water to try and clean anything, their hands and their bodies, at least to get the sand off. I can't even bathe my children. I don't have water. I don't have a space to bathe them. I can't find clean clothes. And I don't have clean floors to sit them on. I worry for my children. They cough and their noses run at night. My oldest son has asthma.
Gaza's health ministry said the number of Palestinians killed in the strikes on the Hamas-ruled enclave is approaching 6,000. The strikes began as retaliation for a lethal incursion by Hamas militants into Israel on October 7th, when more than 1,400 people were killed and over 200 taken hostage. Though families hope these temporary shelters will provide some safety from bombs, health authorities say they are perfect for the spread of sickness. Doctors have warned that critical equipment like incubators for newborns risk stopping, with hospitals running out of fuel to power their generators. The Hamas-run health ministry said 40 medical centres had suspended operations at a time when the bombardment and displacement are putting increased stress on the system. Here's Dr. Nahed Abu Taema, a public health doctor at Nasser Hospital.
The crowding of civilians and the fact that most schools are housing a large number of people. This is prime breeding ground for diseases to spread, such as stomach issues, lung infections, rashes, and this is what we see in most of the patients coming to this hospital for treatment.
The United Nations has called for continuous, unimpeded aid to be allowed to flow into the enclave, and aid agencies have warned that a humanitarian catastrophe is unfolding. The World Health Organization's Regional Emergencies Director, Dr. Rick Brennan, says between only 1 and 3 litres of water per person per day is available in Gaza. That's below the bare minimum international standard of 15 litres per day.
I can guarantee you there's hardly anyone in Gaza that's had a shower or a proper bath in the last few weeks. So we're clearly extremely worried about the spread of infectious diseases in that instance. We're already hearing about increased cases of respiratory infections. Soon we'll run into diarrheal outbreaks, skin infections, and so on and so on. It's just a matter of time.